Not to be outdone, Premier Ford announced new measures for travelers just a few hours after the federal program was introduced by the Prime Minister. At the top of the list for a new provincial plan to combat COVID-19 variant is to accelerate testing for people arriving from out of country starting next week.
Mandatory testing will serve as a stopgap until the new federal measures are fully in place, because we can't take any chances.
Yesterday's modelling showed the UK variant and other variants could put Ontario's pandemic response at risk. Mandatory testing at our borders is the most important thing we can do to stop the spread of these deadly variants in our communities.
The new testing will come into effect Monday at noon for those landing at Pearson. Through the power of the Chief Medical Officer of Health, additional testing measures will also be explored, including land border crossings with the U.S. in the coming weeks. Anyone who refuses a test will face a $750 fine. In Ontario, there are now 51 confirmed cases of the variant, first identified in the UK, including 5 that were detected as a result of a recent voluntary testing pilot project.
We are moving to quickly build the lab capacity to screen all positive COVID samples for variants within 2 to 3 days of initial processing. This will be in effect as early as next week. In addition, by mid-February, 10% of these samples will undergo full genomic sequencing to identify emerging variants.
The province is also asking local public health units to increase case and contact management with asymptomatic contacts. Individuals will be asked to repeat testing on or after day 10 of their quarantine. 2 weeks ago, Toronto Public Health added 280 contact callers and case managers, bringing the number of staff dedicated to tracking the virus to more than 900 in the city. While the province is taking these extra steps for visitors, questions about the current restrictions for those living here are in place until February 10th. Ford would not say if he's considering extending the lockdown, instead saying we are still a ways off from that, and it will be the decision of the Chief Medical Officer, Ontario's COVID-19 advisory table, and the Cabinet.